sort of question?
I mean, I don't have a whole lot of questions.
I know, I think I'll have a lot more questions.
As we inject,
actually injecting.
yes, and
That's what I'm going to be like, okay.
The technique is what I...
oh my god, it makes more sense obviously when you inject. It's a lot of information. We'll give you guys a thumb drive so you have access to all of this.
Okay.
The best thing is for you to go back and read before like you forget about these.
Yeah.
So when are you starting?
This
Thursday. She starts Thursday.
I'm so excited for
But I
you.
pay attention, like when I'm getting my filler, I pay attention to how she does everything. And the fan technique that you're talking about, that's what she does to my marionette lines.
Yeah.
I've paid attention to, like, I don't watch her in the mirror obviously, but I can tell what she's doing and the way she's moving.
And if you
her
give
needle.
me your phone and we have her consent, she can take a video and you go back and just watch your techniques, you know? The best thing is just by doing it. I mean, you have to have some kind of a guts, even if you have to inject your friends, your mom, your neighbor by sailing and
Sailing, just to get used to sticking.
You gotta do it. You can. I promise you can
stick
do
me
it
as much as you want.
Yeah, you just have to practice together, and like my assistant, honestly, if they could like inject their knowledge is
right. I'm sure.
Yeah, because it's just I'm all about patient education. If you educate your patients,
then they understand why they need the treatment.
Yeah, because no adult likes to be told what to do. I don't like to be told what to do. But if you explain it to me in a way, they're like, oh my god, this makes sense.
Yeah.
But it makes perfect sense about what you're saying about the pictures because
it will save.
When I do my before and after pictures, because my family will say to me, my sister especially, she's very skeptical.
Why?
And she had it done one time by a plastic surgeon and her lips got all lumpy. She went with her friend. And she was like, oh my god, what happened? What's wrong? And I said, well, I don't know really that much about it. The only thing I can think of is probably his technique.
Perhaps superficial.
I said it could be his technique. It could be what he used.
You can put all the products away. Thank you.
When I showed her...
Do you remember what product they used for her?
No. I don't.
Yeah. Usually with the lips.
Even with mine, it looks so different like mine before. And that was my very first time.
That's great.
But like, that was what I looked like. I mean, that's terrible. But you don't think about it.
You don't think about it.
No lips. I mean, my lips were always so tiny. And I just, so now, like, it's just so much different.
You see? No, your before after is everything.
That's why I love filler because I just feel like it just smooths everything. And it's like totally
so
magic.
much volume.
So keep this. I want you to have this. I have a lot of a copy of this. This is not the most luxurious thing. I made this like myself, but I think it really helps you to one, educating your patient, show them the muscles. Second, it will also help you to let you know how many units is recommended. Giving you some information about the deep fat pad, superficial fat pad compartment. The deep fat pad, they deflate, D for D, and then and then the deep for deflate, and the superficial they descend. They go down. The reason we have the nasolabial fold is because the fat pad from here has been descending here. That's why we have nasolabial fold. That's why when you do nasolabial fold, first you want to anchor the cheekbone. You want to like support the cheeks first. You have nasolabial fold not because you have lost volume, it's because this fat pad used to be here and now it's here. So that's your superficial fat pad. However, your jowling here is because of deflation of the deep fat compartment. Right. Okay. And then also for your safety, all the good stuff that you want to avoid, be mindful of it. The name of the products, that's going to help your patient forehead, frontal, crow's feet, smoker lines. And one thing about ligaments, and then how many, one syringe is nothing. One syringe is 1 ml, is nothing. One thing I didn't cover with you guys, ligaments. Imagine, think of the ligaments as like a screwdriver. That is, like you have your skin, you have your fat pad, you have your muscle. That's how like the ligament is holding everything in place. And as we get older, these ligaments start falling downward. So when you're injecting, you kind of want to know the anatomy well enough because you want to also support the ligament. So let me explain one thing to you guys. So this ligament right here, mandibular ligament, is what's connecting the skin, fat pad, muscle to the bone. So sometimes when we're doing deep injection, like straight to the bone, is we're trying to support the ligament. Imagine like a door stop. The door is falling. You put the door stop to stop the door from shifting, right? So think of that ligament as a door and think of the filler as a door stop that you're just supporting that ligament. So one of the reasons that jowling happens here is because of the ligament. On the cheek is the zygomatic ligament. So that's why when sometimes you're injecting your patients, you need to know why you're injecting, where you're injecting. Like your cheekbone right there. Where is it? Zygomatic ligament right there. And you can even, like, if there's a suture, if you feel it, like right there, you want to support, like you know how some people just inject randomly? You're like, why are you even injecting there? They don't even know why. So when you're injecting, you kind of need to know why you're injecting. Right. So if this is the suture point, do you see that? It's kind of the bone from your temple to your cheekbone. Yeah. You want to inject in front of the ligament. You don't want to inject behind the ligament. What's going to happen if you inject behind the ligament? You're going to make the ligament heavier. Exactly, you want to do the opposite. And you're like, well, how do I know where the hell is the ligament? Yeah. It's just when you assess your patient, when they're looking down, you can feel it, the little heaviness here. That's where the ligaments are, like ligaments. There's like three main ligaments on our face. Here, 1, 2, 3. And then it goes by. This is a little bit more advanced, but I like for my everybody to know. It's a mandibular ligament, 1, true zygomatic ligament, and then superficial temporal septum. But we'll when we're doing assessment. I'm gonna see if the lunch is here or not. And then you guys, we have option to eat anywhere we want. Let me go check on the food. I'll be right back. Do you ladies need anything?